So now in this video we will look at the uses of NSAIDs. Okay. Now let us look at the first use in low dose aspirin you use for thromboembolic disorders, antiplatelet or antithrombus kind of drug. Now here it is used for the treatment of what? Antiplatelet effect is used for the treatment of ischemic attacks, transient ischemic attacks, myocardial infarction. Okay. In post-MI patients you can use to decrease mortality in post-MI patients you can use, reduce the incidence of recurrent MI. Fine. So where will you use it? Ischemic attacks, wherever there is, what is ischemia? Blood is not flowing, correct? So in such places, for the blood to flow, you can make it thin, use an antiplatelet effect, antiplatelet drug, low dose aspirin. Let's move on to the next uses. The next definitely use will be analgesic antipyretic, correct? Analgesic, it is for minor pains like, headache, toothache, backache, body ache, muscle pain, joint pain, etc. Neuralgias, dysmenorrhea, this we have already seen, correct? So this is the kind of pains it can relieve. It cannot relieve any pain from major head injury or something, but headache, yes. Now coming to antipyretic. Antipyretic, it can reduce fever, okay, but to do this paracetamol is preferred. Please note this, paracetamol is preferred, okay, but actually what is preferred? Paracetamol is preferred because it will not have any anti-inflammatory effect. And why paracetamol is preferred? Because gastrointestinal symptoms are rare and it does not cause Ray's syndrome. This is about paracetamol, so please don't get confused. This is for paracetamol. Okay, better use paracetamol for fever. Better use paracetamol for fever. Okay. Next, acute rheumatic fever. In rheumatic fever, again the word fever is coming, so antipyretic. Aspirin is the preferred drug for rheumatic fever. Aspirin is the preferred drug for rheumatic fever. It reduces fever, relieves swelling and joint pain. So it has anti-inflammatory effect also. It relieves the swelling and joint pain. It does not affect normal course of the disease. That you already know, right? It will not remove the underlying cause. It relieves swelling and joint pain. Very good. So this is rheumatic fever. What about rheumatoid arthritis? Now, anti-inflammatory effect. We are coming to the fourth use we have seen, right? First one was antiplatelet, second was analgesic, third was antipyretic. There we saw rheumatic fever. Now we are seeing rheumatoid arthritis. This is the anti-inflammatory effect of NSAIDs. They can produce only symptomatic relief, but they do not alter progression of disease. This you have to write everywhere. Okay. Now what is rheumatoid arthritis? What is rheumatic fever? Both you should know. Okay. So actually, rheumatic fever is if you have strep throat and it is not treated, it could lead to rheumatic fever. Okay, there you will use what? Aspirin. Aspirin is the preferred drug. Fever is there, but still you are using aspirin because it can also relieve swelling and joint pain. Rheumatoid arthritis is actually autoimmune disease. Here the joints are inflamed and here you want the anti-inflammatory effects of NSAIDs. Okay, only symptomatic relief. Underlying cause is not treated. Now there is another type of arthritis, osteoarthritis. In mild cases, paracetamol is used. So let me go with mild cases, paracetamol is used. In severe cases, other NSAIDs are more effective than paracetamol. So you will use NSAIDs are more effective in severe cases of osteoarthritis. Topical agents like methyl salicylate, diclofenac gel, capsaicin cream can also be used. So you can use these. Actually, these are again NSAIDs only, salicylate, diclofenac, etc. Okay. This capsaicin cream is actually irritant. It will cause irritation on the skin. This will actually help in frictional kind of healing, right? So, osteoarthritis, what is osteoarthritis? Osteoarthritis actually, it's also a type of arthritis. Here what happens, the end of the bones are there, right? They are the flexible tissue that will wear out. Okay, so you will have pain, joint pain and etc. Okay, so what exactly are you expecting here? Joint pain, right? Now let us come, so we have had a flow so far. We had what? First of all, we had antiplatelet effect, then analgesic effect, antipyretic, rheumatic fever, rheumatoid arthritis, osteoarthritis, correct? We have been coming in kind of an order. Now let us look at the other uses of aspirin. See, basically prostaglandins maintain patency of ductus arteriosus, right? Now you want this prostaglandins to work. Yes, if whenever you want the ductus arteriosus to be open, like in congenital heart disease of neonate, then you have to make sure that you won't give aspirin to the child. You will give only prostaglandins. But once you have done the surgery and you want to close the ductus arteriosus, medical closure, normally it will close by itself. If you want to do medical closure of the ductus arteriosus, you can give NSAIDs. In that case, you will give what? Indomethacin. Okay, to close ductus arteriosus, you will use indomethacin. In case of, there is something strange here, you will be surprised actually. Aspirin is reported to reduce the risk of cancer, of colon cancer. Interesting, right? Colon and rectal cancer will, the risk of these will reduce if you use aspirin. Interesting. And aspirin also reduce the risk of Alzheimer's disease. How strange, right? Now, it also controls diarrhea, radiation induced diarrhea. A lot of cancer association is there here. And it is also going to control itching. And it is going to control itching, which is because of the use of nicotinic acid. If you have any flushing, that also can be controlled. Low dose aspirin can be used in preeclampsia. What is preeclampsia? Hypertension in pregnancy, correct? That is preeclampsia. So you can use to treat preeclampsia. Fine. So Alzheimer's disease, you can actually reduce the risk. Cancer risk also is reduced. Interesting. Really interesting, right? What else? Diarrhea also you can control. Itching, pruritus also you can control. Flushing you can control. Fine. So closure is probably a good thing. So closure of the ductus arteriosus. Okay. Those were the uses of aspirin.